I'll break down the positives and negatives of how to score these in a second, but just as a broad brushstroke view, the forwards assessment is how far apart can you get your shoulder blades, how far forwards can you get your shoulders as a result of that, and how far forwards can you reach with your arms outwards. How high can you get your shoulder blades, or how high can you get your shoulders towards your ears from the side, from the back? How far can you squeeze your shoulder blades together, or how far can you get your shoulders to come back, or how far can you reach backwards with this side view? And how far down can you get your shoulder blades, how far down can you get your shoulder to your side, and how far down can you get your shoulder with your arm out in front. In theory, you should be able to do all of these movements with your arm in any position, whether it's forwards, whether it's upwards, whether it's outwards to the side, but you may find that you feel like you can reach a bit further and you can have a bit more control in certain directions with your arms in certain positions. You'll probably feel like you're able to reach further forwards with your arms out in front, and you'll probably feel like you're able to get your shoulder blades more squeezed together with your arms by your side. So factor that into your percentage score in a second. So for the forwards score, if you can get your shoulder here from the side view beyond your ear and almost in line with like the front of your face, like your jawbone and that sort of thing, then that's good. If you can get your shoulders to separate to the point where they look like they're coming out and they're almost like beyond the view, so your back is this one large system and it's difficult to be able to differentiate where shoulder blade is and where musculature is, then that's 100%. And as a subtle thing which is more difficult to measure, but from a subjective perspective, if you can feel musculature in your armpit here, this is called your serratus muscle, if you can feel this activate, and potentially some of your pec musculature as well, as you're reaching forwards without your upper back rounding, then that would be 100% score. If your back has to round, so you have to hunch to be able to get to the point where you can reach this far forward, or you can see that there is a very obvious shoulder blade and it's somewhere further back like this direction, then that will be a reduction in that score. And if you feel that when your arms are by your side, your shoulder doesn't really actually go that far forward, use that to score yourself subjectively. Upwards, what we're looking for is, can you get to the point where your traps basically disappear? So a straight line almost from the top of the shoulder, or your bony bit of your shoulder here, a straight line from there to the top of your neck. If you can get that to happen, then you're basically there. Realistically, upwards is something that most people will be able to do very well. It's very rare that people will struggle to be able to get their shoulder blades up. It's quite rare that people will struggle to be able to get their shoulder blades forwards as well, or your shoulders forwards with your shoulder blades coming apart. They're more common positions for our body to be in. But it's these next two which people will more commonly struggle with. Getting your shoulder blades back, especially with your arms out in front here, is a little bit more difficult. If you can do it really well with your arms by your side, but then you really struggle with your arms like this, then use that as a subjective measure of your percentage score. But if you can get it all the way back to the point where your shoulder is behind your head, then that would be considered a good score. However, if you have to bend your arms and flare your chest to get to this position, then that would be considered a bit of a malfunction. So that would be reduced from your 100% success score. And depression of the shoulder blades is something that people will struggle with the most. It's a little bit more difficult to accurately assess, but what you're effectively looking to see, if you can do, is if your shoulder at rest, say my shoulder at rest sits here, but then by depressing my shoulder blades, I can get those to go further down. That's a start. If you can make them go lower than your resting state, then you have depression of the shoulder blades. If when your arms are out to the front here and you just raise them up at a normal level and then you can still pull them down, then again, that is a success within that movement. And if you can feel that same musculature under your armpit that occurred when you reached forward, if you can feel your lats and that musculature there contracting quite hard, and you don't really have any kind of discomfort in your neck when you do it, then that would be considered pretty much as good as you're going to get. However, you'll see here, for me, I have one side that is better than the other. So my left side is more depressed than my right side, because my right side, I am right-handed, and my right trap is tighter than my left trap. This is a common issue for me, so from that perspective, my left shoulder will get a better score than my right shoulder on most of these tests, but particularly this one. So you can use the comparison between your right and your left as to what percentage you give yourself. So my left here, if I'm going off of a score. In fact, we'll go through all of them. So if I give myself a score on all of these, I think protraction, which is forwards, I think I'm pretty good. So I give myself 90% there because I always want some area to improve. You can see here that you can still see my shoulder blades a little bit, particularly on the right hand side. So I say my right one is probably around the 80% and this one's closer to 90. When I go for the upwards, that looks pretty even. So I'm going to give myself closer to the 90, maybe even 100, because I don't see any benefit to getting any better than that. Retraction is pretty good. Again, I don't see much need to get much better than that. This looks like a kind of strong, proud posture position of the shoulder being behind the head, and this one being my more problematic shoulder. So I'm happy with that. So retraction and elevation are all 100%. But when I look at depression, I'm going to go ahead and give my left shoulder about the 90%, and I'm going to give my right shoulder about that 80% territory. So there you go. So from a forwards and a downwards perspective, my right shoulder is sitting at that 80% for two of them and 100% for two, and my left side is sitting at 100% for two and about 90% for two of them.